Hello, everyone. Today we have Dr. Stephen Hoption Cann, who kindly agrees to talk to us. He is a clinical professor at School of Population and Public Health at the University of British Columbia. You're most welcome, Dr. Stephen. Your recent paper about fever, actually, it's quite a routine thing in clinical and medical practice to use antipyretics when someone is ill and have high temperature, or even when someone is ill. It's a quite common advice to tell them, to consume more food or to drink more fluids. But apparently, that turns out to be not the right thing to do. So could you please tell us more about it, Stephen?
So yeah, so my paper touched on those three aspects of the benefits of fever and what happens with fluid and food intake during infection. So if we look at the animal studies, normally when an animal becomes infected, um, they sort of find somewhere to shelter and stay warm. They don't normally eat or drink that much. And so the question is, whether that is a defensive strategy to help them overcome the infection, or if they're just doing that
Yeah.
because they're debilitated from the infection. So just starting with fluids, so an animal will usually not take in these fluids. But what we find is when we have a fever, the body releases this hormone called antidiuretic hormone, and that hormone helps us retain fluids because the body's trying to conserve fluids during an infection, because all your energy needs to go to fight that infection. It does take a lot of energy. And so
Absolutely.
if the body's conserving fluid and you're taking in more fluid, then you're kind of overloading your system. And what happens is often we see the sodium level in the blood declines because there's too much fluid in the system, and the body's trying to shift that fluid into places,
Mhm.
like it'll shift it into the lungs or to the brain. So you'll get this more difficulty breathing, or you'll get headaches or nausea or vomiting if you take too much dilute fluid when you have an infection. So,
Oh, yeah.
so the challenge is, how much fluid. So you have to look at, if you have a respiratory infection, you're probably not having a lot of fluid losses. So you don't need to take in a lot of fluid, despite the advice saying people should drink plenty of fluid. It's not really helpful to take in that much fluid. So,
Right. So if someone takes in more, because since the start of COVID, one of the main advices that if you feel poorly, just take antipyretics, drink more fluids. So are you saying that's gonna do more harm than good, actually?
right. So especially the higher the fever goes, the more fluid your
Mhm.
body's going to retain. So if you're drinking in a lot of water during the height of fever, you're probably going to feel pretty unwell after that, because the body's going to store it, or you might even vomit up that fluid. Um, but if there are fluid losses, the person should only take fluid containing electrolytes, like an oral rehydration solution,
Yeah.
something like that. So it's fluid with salt and some sugar in it that
Yeah.
the body can absorb, but it's only to replace losses. But you don't need an excess amount of fluid if there's no
Yeah.
tremendous fluid losses.
So how about fever? Is it, I mean, because we always thought fever is a bad thing, is associated with a bad, prognosis, but maybe it's not the case. So is it, let's say, does it affect, the immune cells in a way? Is it better to have fever? And if we suppress fever, for example, in viral infection or in bacterial infection, that's gonna have a bad outcomes.
Right. So what we do know is all mammal and bird species will develop a fever due to infection. So it seems to be something that is seen across a broad range of species. And then when you look at animals that can't change their body temperature, like a lizard or an amphibian, they will move to a warmer environment when they have an infection. So in this way, you can see that across a broad range of species, you get this febrile response. We even see it in fish and insects. There's some sort of febrile response to heat up the body when they become infected to try and overcome this infection. And if we look at it on an immunological level, it does seem like the immune system can work quite efficiently under these higher temperatures. The rapid reaction rates are a little faster, and immune cells do seem to function quite well at these high temperatures. So it's not impairing your immune function if you allow the fever to go.
All right, that's very interesting. But I mean, that's I think okay for adults, but is it the same thing for children, for example? Because we hear quite often, if you let the temperature increases, that might have bad outcomes on children. For example, it might cause brain damage, and I'm not sure if there's a science, evidence behind it. But what's your current thinking about, the high temperature in children as well?
Well, yeah, so for younger children, they're more likely to develop seizures, even though they're quite uncommon. They are more likely than adults to develop seizures, which we call febrile seizures during an infection. So these can be quite concerning for a parent. Generally, what studies have shown is these febrile seizures are not a hazard to the child, even though it's obviously quite concerning if it develops. But this is because, for younger children, like under 5 or 6, generally the brain size is quite large relative to the skull size. So the pressure can increase much more easily in a young child. And when this pressure increases, you do get these seizures. But what's shown is generally it's seen in patients that have a very rapid rise in temperature. And also fluid intake is a key to that, because if you're giving a young child a lot of fluid, which people generally recommend, that fluid is going to be retained. It's going to increase the pressure in the brain, increase the likelihood that seizures will develop. So, again, in this situation, if the child isn't losing fluids and isn't thirsty, there's no need to add fluids to their regimen. It's probably better not to. But if there is a need for fluids, it's better to use a rehydration fluid with electrolytes in it. And that will ensure that the fluid that they take in goes into the bloodstream rather than to the cells, so you don't get that swelling in the brain.
Wow, that's fascinating. I think that's challenging to all the current, medical practice, because we often hear, we have to do quite the opposite. The minute, someone is ill, the immediate advice is just give them plenty of fluids. If they feel, if their temperature is high, use antibiotics like paracetamol or even ibuprofen. So my understanding now, it's better for both adults and children, just to let things go like naturally. We don't do any artificial intervention, basically. Is that correct?
Right. So humans have had to endure fevers long before they invented anti-fever drugs. So obviously, the body must have had a way to deal with these high fevers. And it's really the body that's in control of how high the fever goes. If you look at a normal infection, fever's going up and down throughout the infection as the body advances to fight this infection. And sometimes the fever goes down as it fights it in various other ways. So it's normal for this up and down during infection. And what they found with studies using anti-fever drugs is they don't seem to prevent the seizures in any case. So, you might feel giving these drugs may help your child, but it doesn't seem to make a difference one way or another.
Yeah, but at which point do we have to be concerned? So let's say someone is ill and he has high temperature. So for a couple of days, maybe his or her temperature between 38 or maybe 40. So for how long this is going to be okay before we have to consider really taking antibiotics, or before we get really concerned that maybe something is going wrong?
Well, generally, the body will create higher fever for a more severe infection. So usually every year we have various strains of coronavirus circulating, and generally they cause a very mild cold with mild symptoms and little or no fever. But the ones we've seen recently with SARS and for COVID-19, these are another strain of viral infection where we see high fevers. And so, the body sort of gauges, how serious is this infection and how much fever do I have to contribute to fight it. So a higher fever, yeah, it's concerning because it generally is a sign of a more serious infection. But do we have to be concerned about the fever itself? So they've done studies and shown that, generally if you let the fever go, don't interfere with it, it's very rare to go over 41 degrees Celsius, which is around 105 or so Fahrenheit. So if you don't interfere with it, that's probably going to be the limit. Extremely rare for it to go above that to a dangerous level. And as I say, it goes up and down. And the key thing is, when that fever first develops, a patient will often feel chills or shivering. That's the body trying to give you information that you need to dress more warmly. So for a person caring for that patient, they may feel, this patient feels hot, but the patient themselves feel cold because the body's trying to increase the temperature. So the best support is just to provide warmth, more blankets or hot water bottle or something like that to increase the patient's temperature to the point that they're comfortable. It's no different than if you were going outside in a very cold winter and you wore a light jacket and you felt like cold and you're shivering, you might go back inside and say, okay, I need to get some gloves or a warmer jacket or wear a scarf. And then you go back out and you feel fine in the cold winter because you're appropriately dressed. It's the same with the fever. You want to support what the body's telling you it needs. So the goal is really to keep the patient's skin warm and dry. If the fever is going up, just provide adequate support that they're feeling comfortable. And then if the fever starts to fall, all of a sudden they'll feel really hot. Sometimes they even sweat because the fever drops quite rapidly. And you can take the blankets off and let them cool down comfortably. But it's just following those cues that the body's giving you.
So basically, it's just listen to your body. It's not like a matter of we have to do this, we have to do that. It's just like let the nature does its job. So I'm interested, with when you mentioned, the fever and its relationship with the immune response. So are we talking here about the is there a particular type of immune response of immune cells? I assume it's the innate immune response. Are there particular studies in which they looked at the connections, between fever and a certain type of cells?
Well, it's the full range of immune cells that are becoming activated. So we see the NK cells, the T cells, the B cells that produce antibodies, macrophages, all seem to be more efficient at these higher fever temperatures and fighting off infection. And, the studies with vaccines, so there's been several studies in vaccinations looking at, do these anti-fever drugs make a difference in the antibody response and other immune responses following vaccination in children? And what we know about the immune system is, it doesn't really linger when it's trying to develop an immune response. It's constantly searching for any dangerous pathogens that might enter your body through any route, and developing as rapid a response as it can. So
Yeah.
what these studies have shown is that when you take these anti-fever drugs, and they've looked at acetaminophen and ibuprofen um, versus placebo, that these anti-fever drugs generally tend to reduce the immune response, so you get less antibody production and things like that. So it shows that, you know, here the immune system is somehow being blocked in its full function of developing an immune response to that antigen, and that's a similar thing that it would do during an infection.
It's very interesting. I think especially now with the vaccine, the COVID vaccine rollout, because I mean, I've got my vaccine. I've got the leaflet with it, and it says, you know, if you feel you have fever, you just take antipyretics. So I think that's the opposite thing. What we have to do. So I assume if we take a vaccine, it shouldn't be, especially in the first few days. I don't think, you know, following, you know, to our discussion, I don't think it's correct to use antipyretic drugs, because that might interfere with the immune response. Is that correct? Or are there any studies in which they looked, you know, at the impact? You know, I assume there's none. Do you know, with the relation to either the COVID vaccine or other type of vaccination in adults?
So we don't know with the COVID vaccine because uh, those studies haven't been done. But
Yes.
from what we see from the other studies, the ones in children, it does seem like a lesser immune response. Now, having said that, studies showed that the patients who got the antipyretic drug still got an immune response and still seemed to develop enough an antibody response to have sufficient protection. It's just a much lesser antibody response in subjects that got placebo. So, you know, if you take an antipyretic drug during the COVID vaccination, you may, I think you may likely still develop an adequate immune response. But, you know, there may be a certain degree of individuals who may develop a lesser immune response. That may be a concern, because what we see is a lot of people that have these vaccinations, they may still develop the disease later, but they'll develop a milder form of the disease. But, you know, if you have that opportunity to let your body develop a full immune response, it's better to do that. And, you know, other advice they give is, you know, apply a wet, cool washcloth over the area where the vaccine was administered. Well, you know, when you administer that vaccine, the first thing that happens is you get inflammation at that site. And these are immune cells that are coming in to look at this new antigen that's come in and recognize it, bring it back to your lymph nodes to help you to generate immune response. Obviously, if you're putting a cold washcloth on that site, that's going to impair the immune system from coming in and looking at that. So, you know, there are some side effects due to this vaccine, such as headache or local pain at the injection site and things like this. But these side effects are your body's immunological response against, you know, these vaccine antigens. And, you know, it's likely that by taking these drugs, you'll impair that response, that full response. So you may get a lesser response, which is not ideal.
Yeah, absolutely. That's fascinating advice. Have any antibiotic to eat more or drink more?
Yeah, I mean, I didn't discuss the point on food, but, you know, again, if you look at the animal studies, they show, of course, you have an infection, you sort of lose your appetite. Similar animal won't eat if it's a serious infection, because your gastrointestinal tract essentially shuts down, so it doesn't produce the gastric acid, it doesn't move food through your digestive system, because that uses a very large amount of energy. If you've ever eaten a large meal, you know how tired you can feel afterwards, because all your energy is being used to digest that food. So if your body's trying to fight a serious infection and it's also trying to digest a large meal, that's going to use up all your energy that could have been spent on the infection. So what the body likes to do is it'll tell you you're not hungry, your appetite's decreased, and then all its energy can just be used for the immune response. And what it'll do is it'll break down stored energy such as fat or sugar stored in your liver, and use that energy sort of consumes itself to fight the infection. And we've seen with animal studies that generally if an animal loses a small percentage of weight, they generally have a better survival than animals that are, fully fed during an infection. So you kind of, if you become ill, you kind of have to look at these symptoms and say, okay, I'm not thirsty, I'm not hungry. Body's giving you a message that probably you don't need to eat or drink. If you feel cold, you need to warm up to help the fever, because it uses a lot of energy to develop a fever, and it's much better that you increase that fever by going under warm covers than allowing your body to use up all its energy to develop by shaking and shivering. So it's really important that you just follow those cues that the body's giving you. If you're tired, you need to lie down, and then you're likely to do better during infection.
Yeah, that makes sense, because when we eat more, then I think lots of the energy goes to trying to metabolize the food, whereas at the same time you need this sort of energy for the immune response to defend the body against any foreign things. So that's absolutely fascinating. I'm conscious of your time, so I'm gonna put the links to your paper with the video so people can have a look at it. And I really encourage everyone to go and read it. Thank you so much.
It's great talking with you.
It's a pleasure. I appreciate it. Thank you.
Okay, bye.